So again, thank you so much for allowing me to present about the organization I'm affiliated with and what I do. Again, the name is right here, and this is an organization that I'm affiliated with. We have a office location right here at the UW-Stevens Point at Wausau campus. If you take a look at this map, I am right here in the red dot, as you all are as well. So North Central AHEC is one of the 7 regional centers located in Wisconsin. So you take a look at the map here, there are 7 centers here. The North Central AHEC Center is a part of the main Wisconsin AHEC Center, which is at the UW Madison School of Medicine and Public Health. And this is what I do as a coordinator or education outreach coordinator for AMP, which stands for Advocates in Medicine Pathway Program. What I do is I coordinate activities and opportunities for students who are interested in becoming physicians. So if you take a look at this slide, my position again is coordinating events, right? But the program is intended to recruit students who are from rural or from Hmong backgrounds. And what we do is we put students in, or we coordinate events for them to participate in. So the students are in our program, we ensure that there is a 1-week clinical rotation for them to shadow a physician so they have an idea of what the physician does in their job, the responsibilities, what type of relationship they are building with their patients. Next to that, if you take a look at number 3 here, the students also have to enroll in a 1-credit course at the UW-Stevens Point at Wausau campus for the spring semester. And then after that, they have to participate in a 8 weeks community health internship project. And this is a paid internship. Over the summer, through June and July, be on the lookout for one of our intern. She will be working with the organization with you all, and she will be sort of like a health or a healthy program specialist. And so going back to the Advocates in Medicine Pathway Program, once the students are done with their program, then they can continue on to finish their undergrad degree at any of the 4-year campus that they want. Now, once they're done with their undergrad degree, they can continue on to get their medical degree from the Central Wisconsin campus here, specifically the Medical College of Wisconsin, Central Wisconsin campus. And so what our program does, in addition to helping these students get into medical school, is that we provide the support, and we also provide professional development for them, such as, like, if you take a look at this blue box here, I will be meeting, or I have been meeting with students on Wednesday evenings to discuss about how do they prepare for medical school? How do they prepare to take the huge MCAT exam? Because all medical students who wants to become physicians have to take this test.
Hey, Sheng, I have a question for you really quick. Sure. Is this, and I might have missed this because I stepped out for a second, is this for only students that are interested in being a physician, or is it anything tied to the medical field?
Okay, thank you for that question. Yeah, this is specifically for students who are interested in becoming physicians, so serving the Central Wisconsin campus.
How old can you be?
Yeah, so students have to be like either freshmen, sophomores, juniors, or seniors in college. But this is a program that I coordinate, but students who are interested in going into this program, they can help prepare themselves and engage in several opportunities that are available through North Central AHEC, which I will go in the next couple slides.
Cool.
Yeah, and so one of the perks of being in this AMP program is that students get a free laptop to take with them and to use for the remainder of their education. So this is basically the program that I coordinate. These are Wisconsin programs or North Central AHEC programs. the programs in the left here are programs specific to the Wisconsin AHEC centers. So all of the 7 regional centers have these programs. Here on the left here are programs specific to our North Central Wisconsin region. So those of you who are like at the high school level or thinking about medical school or even like college, you can participate in the Futures Physicians Day. Again, it's open to high school students and college level students. Each year in the month of August, we open up applications for students to apply to participate in this program. And then this program is a partnership with the Medical College of Wisconsin, Central Wisconsin campus. It's designed for students to engage in like hands-on activities, for them to also get into like different breakout rooms or sessions with the professors at the campus so that they can engage in conversations pertaining to like medical school with these professors. Then we also have the Overcoming Addiction Together workshops. This is specific for college students and professionals. And then I think at your level for high school students, we have the Upward Bound program that we are in partnership with the UW-Stevens Point at Wausau campus. This is open generally around July and August of each year. And so be on the lookout for this program when we do open up application. Here are more like this Wisconsin AHEC signature programs are more specific for the college level students, but these two specifically are activities that you can engage in to help prepare you for like medical field or interest that you are going to.
And I think we've had students from our Greenhack Fieldhouse location. I think they've attended Upward Bound a couple different summers previous to COVID. So we have a lot of students from Boys and Girls Club that have participated in those things, which is really cool.
Yeah, terrific. Yeah. And then going back to the community health internship programs, in the next couple months, we will have a CHIP intern at your site. So she can share all about our program and our center with you all.
I'm really excited. She's going to get to work with you guys about learning even more about the medical field and other stuff. So that'll be really cool.
Yeah. Oops. Sorry about that. My room's lights typically turns off whenever there's no movements. So, okay. Okay. So this is a group of students that I get to help plan opportunities in these educational and professional development sessions. So I have Macy that's in the cohort this year, Morgan, Emma, Long, New, Ariel, Sitha, Kusang, Micah, and Kayla. All of these students are either from Hmong backgrounds or from rural communities because that's the whole point of this AMP program. We want to recruit students from these communities so that they can graduate and complete their education and training and serve in these communities. And over here is kind of like an analogy about the AMP program. So again, recruiting students from the Central Wisconsin area or have ties to the Central Wisconsin areas, putting them through the AMP program so that they will become like very successful physicians in their communities. Here, I didn't mention these three people, but Amy Pranosky, Dr. Amy Pranosky, actually going back, all three of these are doctors. Dr. Pranosky is the person that's in charge of the AMP program. She wrote the grant for this program. We received this grant in July, and then right around August was when I was hired on to lead this project with her. This is Dr. Erica Chu and Dr. Sarah Locke. They are both affiliated with the Medical College of Wisconsin, Milwaukee campus. They are also practicing pediatricians. So very knowledgeable individuals. Both of them attended or led this session with the AMP students with like how to prepare for interviews and how to be better when it comes to like improv, where you have to give a presentation or do a quick speech at very short notice. So this was a very fun session. And these are the different types of organization or things that I do aside from the AMP program. I help in coordinate programs for medical students. I was part of the flu vaccine clinics that is part of the WIPS organization for communities of the Hmong and Hispanic communities. Again, this is a picture of the flu vaccine clinic held at the Hmong American Center here. This is their logo, and this is the Wausau Free Clinic logo. Before I go into about like my background and how I came into this position, I wanted to describe what my typical day looks like, because that was one of the area of interest. And so a typical day for me as the education outreach coordinator is pretty much answering and looking through my email, responding to people who are interested in the program, outreaching to organizations like the Boys and Girls Club, and again, creating opportunities and awareness about the program that I am running. There's also like different sessions and different meetings that I have to attend so that I can better develop this program. And also be more aware about what's happening in the community, so that whatever information I'm sharing with the Advocates of Medicine Pathway students, they are aware about what I'm doing in the community they are going to eventually practice in. Let's see here.
Sheng, I'd love to add a comment too. So
Sure.
as we get to see all these different types of careers that you could go into in the future, this might not be one that you think of, right? So say you like to work with, well, I know you're not that old yet, but as you get older, you decide like, maybe I like working with kids, but not younger kids, and maybe more that high school, college level. Maybe the whole physician idea is interesting to you, but you don't want to be a physician, or that you get to help people get interested in things, like how Carol will talk about how she likes to help kids into what they are interested in. This is an opportunity to work with that age level, but help them in a different way while still being involved with the medical field. And it might be something with your background or ethnicity, all these different ways that you can build that together. So it's just really neat to see a different side of things kind of like this. So you might think, oh, I want to be a teacher, but you never thought about this type of career either. So it's really neat to get to see something different like this.
Yeah, definitely. Thank you for so much for sharing that as well, because when I was going back to school for my healthcare administration degree at the UW Stevens Point, I had no idea that I was going to land this job. So this is pretty much a collage of kind of like the very critical experiences that I gained. Starting with the DC Everest Middle School and DC Everest Area School District, I was a teacher assistant specifically for the students who speak and understand the Hmong language. I had no idea that how applicable this position will be with my engagement and experience with working with these students in this population. I had no idea how critical it will be for me in this position. Same thing with this visual here. This is a picture of the Multicultural Resource Center event that I was involved in. This opportunity allowed me to work with college students, which I'm working with right now. Going back to going with the DC Everest Middle School, this opportunity allowed me to work with middle school age students, much like you all. And then with AmeriCorps, this opportunity allowed me to work with a variety of people from all walks of life. I work with nonprofit organizations. I work with private organizations. I work with parents, students, children. You know, I also work with like the very vulnerable populations, such as like people who are homeless and who are looking for like rental assistance or housing assistance. And so with AmeriCorps, my host site was with North Central AHEC. So that's how I was able to gain those experience. And it also like helped me understand like the difference between nonprofit organizations and like private organizations, a better understanding about those types of organizations and how they function. And you know, this experience again is really critical in that I'm using it today. I get to engage with nonprofit stakeholders, private organizations, and how they can help us better the ANT program or even the community-wide. I also worked for Aspires Wausau Hospital briefly while I was going to school. I had no idea when I was going to school and working here part-time how, again, how important the role of Aspires will be, because they are also one of our partners with this program. And we are in arrangement with them to set up with the clinical rotations for these undergraduate students. And then again, if you take a look at this visual down here with the UW Marathon County campus, when I attended this campus, it was the original name. Now it's UW Stevens Point at Wausau. And here I am, like this office that I'm in right now is at the center. So I had no idea that all these things would come into full circles. So like what Alexis is saying earlier, the things that you're doing right now may not make sense, but 5 to 10 or maybe 20 in your case, years from now will all make sense, and it will be very, very applicable to what you want to do in the future. Because when I went back to school for my healthcare administration degree, what motivated me was just, how do I help my community? How do I help my family's members? Because growing up, I always had to serve as interpreters or like liaisons for my community and family and friends who do not know how to speak English. And I don't know about you all, but when I was young, going to the clinic or hospitals was very intimidating. I was very scared. I didn't know many things. And so I was motivated to pursue this degree so I can understand the health systems a little bit more and help my community and, you know, family and friends. But, you know, here I am serving as liaison or coordinator for a health focused program that's, you know, in connection with these health systems and medical schools. So it is very much a privilege to be in my position, serving my communities. Do you have any questions before I continue? Because this is really the last slide of my presentation.
Anything you guys can think of? I actually have one. So I know that, so we've been connected of working, you know, with Boys and Girls Club, which is a nonprofit. I don't know if you guys know that. So when she's talking about nonprofit, that's an example of one. But what is kind of like the most obscure group or fun group, maybe you want to say, or interesting group that you've gotten to work with?
I would say, just from my past experience, it would be working with North Central Community Action Program. That has to be the most challenging group, just because I am meeting people or helping people who are in need of shelter. And shelter is one of the basic needs, but having the opportunity to help people secure shelter was very important to me, and was it made me felt like I was able to help people when they needed the most. So North Central CAP was probably where I was able to meet the most challenging clients or challenging situations.
Yeah, very neat. Any other questions you guys can think of? Awesome. All right, they're a quiet group today.
And I did go over my slide fairly quickly, but let me touch on a little bit of these pictures. This is a picture of me and a few of the committee members of the Higher Education Scholarship Committee with the Hmong American Center. Here's myself and the other committee members. Again, when I was participating in this volunteer opportunity, I had no idea how I would be working with higher education, but it became to be a very, very critical experience for me to apply in my current position. The same thing with this picture down here with the 3 different principals of the different school district. I was a logistic manager of a Hmong dance troupe called Ban Chuan Blai, or in English, it's called Roses. And so again, didn't realize when I was doing this that it would be so applicable because the students or the population I'll be working with are going to be Hmong, and this experience really kind of like opened my eyes and allow me to work with students or people of that background. Let me see if I can go back.
And I just wanted to say, Sheng, thank you for, I think it kind of brought everything back, especially with the age that we have, of really making sure that you guys take every opportunity that you get to do. Just like she said, it might not make sense now, but it's all going to lead up to experience that will help you out in the future. Whether it gets you into the career you think you're going to go into now, or maybe it's a job you work at for a little bit and then you move into another career. There's so many things out there that it's really neat that you keep your eyes open and try new things, so that you always, you never know what it's going to lead to. Okay.
Mm-hmm. Yeah. And I do want to do like a quick disclosure that, you know, of course, English is not my primary language. So when I went into this position, there was just so many acronyms, right? So there's North Central Area Education Center. There's Advocates in Medicine Pathway Program. There's also Education Outreach Coordinators. So there was just so many programs, and all of these different titles and names were tongue twisters for me. And so what I did was that specifically to my title, it was such a long title for me. Although I felt very privileged, it was very a long title for myself. And I was thinking about tricks, like how do I trigger my memory about my title and what I do? And so I shorten it to acronyms like EOC, so I remember my title. Again, North Central Area Health Education Center, it's shortened to North Central AHEC. So whatever you do, you know, use some tricks to help you trigger some memories so that you can be better at your job. Also, a lot of visuals to help you trigger memories or help you be better at your job, if there are any. Let's see here.
Is it okay? Is it okay if we do the raffle? Would that be okay?
Yeah, that's fine with me.
Awesome. All right, I have everyone's names written down. So I'm going to shuffle these up. And Antika, I'm going to have you close your eyes. I'm going to have you reach out your hand. And you're going to pick one. Anyone you want. All right, open it up. Who is it? Carissa. Carissa, you get the water bottle today.
Yay! Congratulations, Carissa.
Carissa said, I am so excited I'm going to win that water bottle when she signed up. So that was awesome. Very cool. All right, Sheng, is there anything else that you wanted to touch upon, or is there any other questions that you guys have? Antika, what's your question?
Will we do this again?
Will we get to do this again? So we have our celebrity chats a couple every month. And maybe we will get to talk to Sheng again sometime, but not like in the next month, probably. Does that sound good? And maybe, Sheng, we can talk about other ways to connect about anything else too, or if anything pop up, let us know.
Mm-hmm. Yeah, and certainly there again will be a CHIP intern over at your facility, so reach out to her when she does place there over the summer. Alexis has my information, so she can also reach out to me if you have any questions pertaining to medical school or community or anything that you have in mind that you want to help with.
Is there anyone that would be willing to share the most interesting thing they thought from the presentation today? And you can pick an extra prize out if you share with Sheng and us all about something interesting you thought about this presentation today for the celebrity chat. Ryan, you want to share?
I learned that being in the something interesting I found is working in the medical career could be fun.
Working in a medical career could be fun?
Yeah.
Awesome. Thank you, Ryan.
Interesting that I learned. When you're in college and stuff, you get to do this stuff. I never knew that.
Yeah, in college, there's a lot more opportunities that you didn't know about, and that you get a laptop to get to use for it, and they help you set up and create all these different opportunities that you can be a part of. It's not just, I want to be a physician, and then you're kind of stuck on your own, right? There's this awesome program that you can use. Yeah. Carissa,
If you want to, you can become a doctor.
if you want to, you can become a doctor, right?
Yeah, and you can become a doctor by staying right here in Wausau. You know, you can go to the UW Stevens Point to get your 4-year degree, and then enroll at the Medical College of Wisconsin here in central Wisconsin, and you know, you don't have to move at all.
And I think what's so important too is you talked about, and especially in your role, is how much you can help your community. Like, you don't have to necessarily be in a position that you typically think that might do something to help the community, but you're able to help the community in so many different ways. That's really cool to think about. If you know you like doing that, like a lot of you guys like to do our club service projects and help community members and do things for our community. That might be something you want to do as your career, which is really cool. You can have a career helping others in our community. So keep your eyes open for those things. Carissa, did you have one more thing to share?
I just wanted to say that being a doctor is one of my dreams to become a job.
Cool. Could you hear Carissa back there?
No, I had a hard time.
She said that becoming a doctor is actually one of her dreams, to become a doctor as one of her jobs.
Terrific. Yeah, reach out to me if you have any questions or how I can help you, because the AMP program that I coordinate events for, activities for, our goal is to help students get into medical school. So reach out to me.
Awesome. Last thing, Annika?
I was gonna say I had the best time listening to your stuff.
Oh, okay. She said she had the best time listening to your stuff, so thank you.
That's great. Thank you so much.